My name is Anita Charlesworth. I'm Chief Economist at the Health Foundation. In this presentation, I'm going to talk about the challenge all political parties need to face following the next general election. The Health Foundation has published an analysis of the funding issues facing the NHS following the next general election. The NHS is likely to be a key issue in the general election, with 46% of the public identifying the health service as a key issue of concern. This is a substantial increase on the levels of concern at the last general election, where 26% of the public reported the health service as a key issue. Since the NHS was established in 1948, public funding for healthcare has increased by more than inflation and economic growth, rising from 3.6% of GDP to 7.5% of GDP in 2013-14. As a result of the rapid increase in public spending on health, health now accounts for almost £1 in 5 of all government spending in the UK. Within this overall increasing trend, health spending in the UK has experienced periods of relatively high and relatively low growth. Between 2000, 2001 and 2004-05, health spending grew by an average of 8.7% a year in real terms. This is the highest rate of growth during any parliament since the NHS was founded. The current parliament will be the lowest yearly rate of change in health spending since 1955. Total health spending, that's spending by the government and individuals out of pocket and through private insurance, in the UK is comparable with that of the OECD at 9.3% of GDP, but this is lower than the average for the 15 major EU countries, which spend 9.9% of GDP on health. A high proportion of health spending in the UK is publicly funded compared to other countries. Publicly funded spending accounts for 84% of health spending in the UK. This is the third highest level amongst the EU 15 countries and the joint fifth highest across the OECD. The average across the OECD is for 72% of all health funding to be funded by governments. Since 2009-10, health spending in the English NHS has increased slightly faster than inflation. But the population has grown substantially, increasing by 1.65 million people over the last 5 years. As a result of the growing population, spending per person actually fell in the first 3 years of this Parliament. It was only in 2013-14 that spending per person increased by more than inflation. Whilst the NHS has been protected from the full impact of the government's cuts to public services in order to address the fiscal deficit, the growth in funding is significantly lower than the historic average of 3.7% a year. In the early years of this Parliament, the NHS appeared to be managing well with constrained resources, but in 2013-14 there were increasing signs of financial distress, and spending grew faster than was planned. In December 2014, the government committed additional funds to the NHS for both this year and the following year. As a result, over the Parliament as a whole, spending on the English NHS will increase by an average of 0.9% a year in real terms. The pressures on the NHS are principally being felt in our acute hospitals. By September 2014, some 80% of our acute hospitals were unable to balance their books. The primary reason for that is the rising costs of staff. This is not a result of increasing pay, but rather the result of two factors. A sharp increase in the number of nurses employed by acute hospitals. This is largely in response to concerns about the quality of nursing care following Sir Robert Francis's inquiry into the Mid Staffordshire scandal. In addition to increases in the number of nurses, the NHS has also experienced a sharp rise in spending on temporary staff as it struggled to recruit permanent employees. Spending on temporary staff increased by some 28% in 2013-14 alone. Work by the University of York suggests that over recent years, productivity in the English NHS has increased by an average of 1.5% a year. That's below expectations for the economy as a whole, where the government's official economic forecasters, the Office of Budget Responsibility, suggest that productivity for the UK economy should grow by 2.2% a year in future. Each year, the NHS in England faces additional spending pressures, which are estimated by the Health Foundation and others to rise by about 4% a year in real terms. These are the result of a growing and ageing population, the increasing prevalence of long-term conditions, higher expectations, and rises in the relative price of healthcare inputs. That's principally staffing. NHS England, in their recent 5-year forward view, estimated that these pressures will result in a potential funding gap of £30 billion by the end of the decade. NHS England suggests that this potential funding gap should be reduced through further productivity savings. If productivity continued to rise at 1.5% a year, NHS England estimate that the funding gap could be reduced to £16 billion. However, if productivity growth in the NHS could be increased to between 2 and 3% a year, this could bring the funding gap down to £8 billion by the end of the decade. At the Health Foundation, we have developed the modelling approach used by NHS England and others to examine what might happen to health funding beyond the next Parliament. We have examined the pressures on the health budget out to 2030-31. Our analysis shows that if health funding pressures continue to rise in line with recent trends, and the NHS continues to improve productivity at 1.5% a year, then the NHS faces a potential funding gap of up to £64 billion by 2030-31. To meet this funding gap, funding for the NHS would need to rise by around 2.9% a year, over and above inflation. That's faster than the rate of economic growth that the government is forecasting. Government estimates that economic growth through to 2030-31 would rise by around 2.3% a year. As a result, the UK would need to spend a growing share of its GDP on the health service. Although the NHS has been protected from the full impact of the government's austerity drive, the service is showing growing signs of financial distress. And a key challenge facing any incoming government this May will be how to sustain, let alone improve, the quality of care whilst delivering fiscal balance. NHS England has set out an ambitious and radical programme of reform for the NHS in its recent 5-year forward view. There can be no doubt that change on this scale is required, both to meet the financial challenge, but also to ensure that the health service is able to meet the needs of an ageing and growing population. The key question facing the NHS is, can it deliver change quickly enough to unlock the required productivity savings, even under the NHS England's most demanding productivity assumption? But they recognise that the NHS will need an additional £8 billion extra over and above inflation by 2020-21. Any incoming government in May 2015 needs to do 3 things in order to secure the NHS for the next Parliament and beyond. Firstly, it needs to recognise that delivering change on the scale in the 5-year forward view will not happen without sustained effort and proper resourcing. To support that, it needs to establish a transformation fund to provide the financial assistance necessary to underpin change. This transformation fund is in addition to the resources required to maintain day-to-day services. A new government also needs to commit to the additional annual funding for the NHS set out by NHS England. That's an increase of 1.5% a year over and above inflation, rising to £8 billion by the end of the Parliament. But a new government needs to recognise that this is a low and ambitious estimate, and if pay pressures in particular turn out to be higher than anticipated, the NHS may need further funding. But as our analysis shows, the funding challenge facing the NHS doesn't disappear beyond the next Parliament, even if the NHS succeeds in implementing the vision set out in the 5-year forward view. Our central estimate is that if the NHS continues to deliver productivity improvements in line with recent trends, funding pressures on the NHS will rise by 2.9% a year over and above inflation, amounting to some £65 billion more than inflation by 2030-31. Over recent decades, additional funding for the NHS has been accommodated as other public services have reduced as a share of GDP. This has created headroom for the health service without the need to increase taxes, but it is difficult to see how this can continue. And there needs to be societal agreement about how to sustain the health service in the long term. You can download the full finance briefing at the Health Foundation website.